I'm Dr. Nicholas Beasley here. Thank you so much for choosing Woody Medicine. I think it's really important that we start out and give you a little bit of a rundown of what acupuncture is and how it works. So basically, 1,000 years before the Bible was written, the Chinese people understood how to stimulate the body in a way where it would self-heal. So what they've done over time, they've slowly refined their arts to now we have small, tiny little needles which we use to elicit and stimulate a certain reaction in the body. So what happens is, let's say if we use a peripheral nerve or a proprioceptive nerve here on the ends of the body, this can cause a cascade of healing effects. When we place one of these pins in here, there's a synapse that travels to the brain and back. It's usually about in between 20 to 40 foot a second. It's a very fast and very strong sensation that goes straight to the spine, up them to the midbrain, and that stimulates the cerebral cortex to light up. What that does then is it initiates and signals to the pituitary gland, hey, we've been hit. Let's send out some natural endorphins such as oxytocin, dopamine, serotonin, as well as these natural opioids that the brain produces in acute trauma called enkephalins. And enkephalins have been shown to be up to 100 times the strength of morphine. So our body has all of these natural health qualities that it can deal with acute trauma. And what it'll do is it'll send all these enkephalins out and receptor sites across the spine and of the nerve that's innervated, as well as on the capillary beds there. And the body just floods itself with these enkephalins, these natural pain killers. What's really, really cool about it with acupuncture is we are trying to reboot and re-establish a healthy pattern with the proprioceptive pathway. When we're in pain, there is two nerves involved. One is nociceptive, that is the pain signal. That's firing. There is no issue with that with most people. But the issue is the proprioceptive pathway, which is being diminished or weakened over time. Now, this is a natural and healthy thing that happens in chronic pain, because usually when we have an injury, we don't have any trouble knowing where the pain is coming from. But if that injury is allowed to carry on without any self-correcting or self-healing, basically what happens is the brain stops sending blood supply to that area in fear of any form of infection or really big trauma. So it basically shuts down the muscular junction of that area. And so that's why we end up, when we have an injury, we end up like locking up and not using an area properly. And over time, this leads to a lack of blood flow and a lack of nourishment, a lack of these anti-inflammatories to an area. So what we do with acupuncture, and it can be quite strong at the first session, is we stimulate the proprioceptive pathways through areas in distal acupuncture, which such as the hands, the ankles, the wrists, the elbows, the knees, to reboot that system so that the brain can get back to healing itself. And the results are immediate. We can get people that have been in chronic pain for 10 years with pain drop from a 10 to a 1 just in front of us within less than a second. And we do this constantly all day, and we're just trying to help. So what we're trying to do is re-establish that. Usually what will happen at this point is the patient will go away, feel amazing, feel fantastic, and then the pain will come back. So usually I get the patient to come back in that same week or the week after. Eventually, after about 6-7 sessions, the pain's down overall about 70%. But I really recommend patients commit to at least 3 months, 12 weeks of treatment to really drop that pain properly. We just want to make sure that that's fully not coming back and that's healthy healing. The great thing about it is that every time you come into the clinic, you will walk away with less pain, and eventually that pain will stay away much longer. So acupuncture is a tremendous tool for treating this proprioceptive pain, this chronic idiopathic type of pain where essentially there's no local inflammation, no swelling or no redness in the area, but there's just constant dull ache. It's very powerful for that. Okay guys, I hope this is a little bit just to give you some information that you can sit back on. So when you book in, really be thinking about committing to a few sessions just so that you can have this full effect of acupuncture.